Gautam, MCH Plastic Surgery. I'm here today with Dr. Anshuman Manaswi, a board certified plastic surgeon, and we're here to discuss the most frequently asked questions about male breast reduction. So, sir, first starting with the main question, what is gynecomastia?
Okay, welcome everybody. Gynecomastia is male breast enlargement, and it can happen in the young age, in the adolescence, in most of the cases. And the second cases, they come in a old age, which is called senile male breast enlargement. They are usually benign, whether it is one-sided or both-sided, but usually benign. But one must remember that in case you are having one-sided gynecomastia or male breast enlargement, should get definitely checked up, because sometimes there may be some tumor in the breast which needs to be found out.
How can a patient identify that he has gynecomastia?
It's a very subjective feeling. I mean, there are no hard and fast rule for it for the patient. The moment you feel that you are uncomfortable dealing with the size of the breast, that is the time to see the doctor.
Are there any non-surgical methods to control gynecomastia?
I'm sorry, there are no non-surgical methods, but in case the gynecomastia is very less, then in terms of low-fat diet and exercises would melt the fat part of it. But usually the gynecomastia has got both the fatty component as well as the gland, and these glands don't go with any of the techniques of non-surgery, whether it is non-surgical ultrasound, radio frequency, whatever XYZ people may be advocating, or whether it is that. And usually it occurs due to the hormonal imbalance, which happens mostly due to the age, pivotal age, and especially is very common because of fast food culture which we have. Because these fat food cultures make us more obese, and fat, the more the fat, the more the chances of patient having more female hormones because of some enzymes which are there.
So, sir, what are the surgical options available to manage?
Surgery is very simple, and the most frequently practiced surgery is removal of the fat through liposuction and removal of the gland through a small cut which is there just around the areola, hardly seen, and it's a daycare procedure, mostly done under general anesthesia, but if it is very small, we could probably do it under local anesthesia, and patient goes back in the evening.
So what are the risks involved with the surgery?
Usually surgery does not have any complications, the surgery, but yes, it's a keyhole surgery, as you would understand. So some patients do have blood clots which can get accumulated over there. So we advocate a pressure dressing over there and less activity for a few days, couple of days. So that is one risk which is obviously not very common. And the second thing is kind of infection in the stitches, which is also not common. And the third thing is some irregularity in the contour, which may or may not be there, but overall the results are very satisfying.
So what are the precautions to be taken post-surgery?
Post-surgery, the most important thing is to wear the pressure garment for at least a month, and that's it, and come and show to the doctor as per the schedule to do the dressings as per the schedule, that's it.
So how long does the pain post-surgery last?
Not much, a couple of days. There is some amount of stretch which is there for around 10 to 12 days or 15 days time, and gradually it all subsides. Most of the people resume their normal duties from the next day or day after.
Is there a possibility of recurrence of the breast enlargement post-surgery?
Very, very, very low probability, less than 0.01%. If it is recurring, it may mean only two things: either the surgery was not done properly, or there is some tumor which is arising or something else. So if you have a recurrence, it is important to seek advice as early as possible.
When can the full results be appreciated?
After a couple of months, when the swelling is down and out, and patient goes back to the normal life, exercises, so that everything falls in place.
When can a person post-surgery resume workouts in the gym, heavy weightlifting, chest exercises, back exercises?
Aerobics we allow after 15 days, but isometric exercises where a lot of blood gets pumped in over there, we tend to tell the patient not to do it for at least a month, ideally around 1.5 months.
What are the prerequisites for a candidate who wants to undergo the breast reduction surgery for gynecomastia?
Patient should be wanting it and patient should be fit for anesthesia. That's it. A lot of time parents are sort of unwilling, and that's not very fair because the psychology with the child has at that age lasts for long. I mean, one is not able to go to the swimming pool or not able to wear tight t-shirt. These are something they feel embarrassed about and they start going into inferiority complex. So I think parents should be much more open to it. It is a very safe surgery and very, very rewarding for the patients.
I hope we've answered all the questions that were posed for male breast reduction. Thank you.
In case if you have any more questions, you could write to us and we would be happy to get back to you or make another video to address those questions. Thank you so much.